Cancer continues to be a significant health challenge in Uganda, with new statistics shedding light on the severity of the situation. However, the situation is compounded by the fact that only a fraction of these cases, roughly 20%, make it to the Uganda Cancer Institute for care.
Mulago campus, which is UCI Mulago, we see between 6,500 and 7,500. And at our Mbarara Center, the Western Uganda Regional Cancer Center, we're seeing about 1,200 new cancer patients every year. And the commonest cancers, of course, haven't changed. Most of our cancers here, the commonest is cervical cancer. Cervical cancer, you know, is infection-related. It's a cancer of women and still the commonest over the past couple of years. And then we have prostate cancer being the commonest in men. And also about 10% of all the new cancer cases we see occur in children. So about 600 to 700 new cases of cancer in children are admitted at the Uganda Cancer Institute every year.
According to the Uganda Cancer Institute, an estimated 56% of all new cancer cases and 70% of cancer-related mortality occur in low and middle-income countries like Uganda. So, everyone must join the fight against the spread of cancer. Awareness, early detection, and access to treatment are crucial in combating this epidemic.
It's really an opportune moment for us, as I said earlier, to also review some of the key policy direction that our government is taking. And this is actually being led by the Uganda Cancer Institute.
A number of people think cancer is not curable. So it is the job of Uganda Cancer Society to bring together cancer survivors and demonstrate to the patients and even us that cancer is actually curable if detected and treated early.
As efforts continue to address the cancer crisis in Uganda, the call to action is clear. United, there can be a difference in the lives of those affected by this disease. According to Nixon, there has been a number of interventions by the Institute at Mulago to curb the virus down.
It is going to focus on what we're doing at the Mulago campus to address the challenge of cancer. And one, if you've been at the Cancer Institute Mulago, you know that we have significant numbers of patients. The Cancer Institute is currently a 149-bed hospital, and we are in the process of expanding this from 149 beds to 353 beds over the next 18 months. And the goal of this expansion is really to improve the patient spaces, but also to cater for every patient who comes to the Uganda Cancer Institute.
As Uganda Cancer Institute alone, you cannot educate all the people in Uganda about cancer. So what are we doing? We are strengthening the capacity of the district health facilities and the regional referrals in the country to be able to provide certain element of cancer services in their country.
Jane Nyuramchia, Dan Lugemwa for UBC News.